Hey guys, welcome to I Got You Girl. I'm Felecia, your host, and I am excited today for this podcast. This is a special one, so you guys want to buckle your seatbelts and get ready. I have with me today who has now become a friend and doctor, Renee Terrell, here in Union City, Tennessee. And I had shared with you girls about getting the pellets and doing the bioidentical hormones. And so I had asked Renee last year if she would be willing to come on and share her expertise as well as her availability to help you girls. And I think that you guys are going to be excited. I started coming about a year ago. And I had done bioidenticals.
Yes.
And mine were the internal ones, right? And remember me questioning you up and down. I did the blood work.
Yes.
You did all this. I had researched.
You did all the homework.
I stalked you, girl.
And she knew her stuff too.
No, I wouldn't go that far.
did.
But I did. I stalked you because I was so afraid because of how good I felt even at that level. That if I started the pellets versus the bioidenticals, that it would be like, oh, what have I done?
You might tell a difference. Yeah.
And so you were so cute. I'll never forget that day of that office. You rolled that little chair up there and you said, "Are you ready?" And I said, no, not yet. Let's talk just a little bit more about this. And then I did the pellets. And I think it was 2 weeks later I had to go to market. And I literally was out in the aisle. They had this one guy doing music and I'm out there dancing too. She's a brick
You
house.
were. I saw it.
Girl,
yes.
I was stoking it. You hear me? And have been ever since. It's crazy. Everybody always wants to know my energy. So, having said that, I want you to share, how did you get involved in this? Where did you start?
Well, what happened, I went through a spell where it was perimenopausal. I was 42. And I had no hormone in my body, which was probably caused by an autoimmune thyroid disorder, which at the time I didn't know. And I didn't know how it was all tied together. And I just was one of those people that I spent a year and a half around here trying to get people to help me to either do creams. I wanted to do a bioidentical route. I would have done anything at that time. I was so miserable, but I had the extreme fatigue, the extreme joint pain, joint aches, brain fog was unbelievable. And some women will tell me they just feel more scattered or like they can't keep on task as easy. But there were a lot of symptoms that I had and I just couldn't find anybody to help me. So I found Dr. Gary Donovitz in Dallas, and he was with BioT at the time. And I got blood work done, hopped on a plane and went there. And I got pelleted, and within 4 or 5 days, it was just like a light bulb went off. Like I was on the plane with the girl that went out with me, and she got pelleted at the same time. And it was life-changing. And I was like, I have got to be able to do this for people, because this is the most common cause. You're going to get people that'll come in the office at 40 or later, and they've had blood work done, but they're just not, the providers aren't getting the right stuff, and they can't figure out why they feel so tired and fatigued, and they just don't feel well. And a lot of times it has to do with the hormone levels and where they're at, because I'm a firm believer, I think our hormone levels are more likely to be down at an earlier age now because of a lot of the things we're eating.
Foods.
And a lot of the foods and meats have hormones added and things like that. So I think I've just seen through the years, it's younger and younger and younger this is starting. So the first thing I wanted to do is be able to do it bioidentically. That means that your body senses this as your normal hormone, so we're not increasing the risks of cancers and heart attacks and strokes. And we know by the time the age 40 rolls around, we're losing our vitamin D, we're losing bone mass, we're more apt to develop plaque in the arteries and have an increased risk of breast cancer and cancers in general. And so we know testosterone replacement can reverse some of that out.
Okay, I have a question for you saying that. I hope you won't lose your train of thought.
No.
Because a couple of things you hit on that I loved. You said that you were very intricate in making sure that blood work balanced to the level, I think, that you want to see it, that should be normal.
Yeah.
And I love that about you, because I know there's a standard normal and then there's a real normal.
Yes.
And you are the one that really goes after that real normal. I love that. And that to me was powerful. Having done the years of what I've done with this, been, taking it or using it. Okay, then the second thing was, and I know there's a lot of question around this, like I've heard a lot of women say, can I really use the pelleting and the bioidenticals if I've had breast cancer or if I've had uterine cancer, that sort of thing?
You can. And now, obviously, you have to go to somebody that knows how to do that, which I do. If it's a hormone receptor positive breast cancer that they have, they can still do testosterone replacement. You just make sure the estrogen's blocked out. Right. So we do have a pellet that does do that. So there is no reason for a woman who's had a history of breast cancer to not be able to get their hormones optimized.
I love that, because that is probably the number one question right there. Also, another one, I remember you saying this too, and I hope I can say this, is that you and someone that you know, a colleague, had you've been doing this 15 years. Yeah. Wow, that speaks volume right there. A long, long time. And I know a lot of the girls that have come to you, and they speak so highly and feel so good.
Thank
and
you.
It's amazing. You're changing women's lives.
I hope so, because I know it changed mine.
And that's powerful. That's what it's all about.
Just because we're getting older doesn't mean we're dead from the waist down or the brain down or whatever. I mean, that should be the best time of our life.
It should be.
It should be the best time. And the reason it's not for some people is because they have no hormones.
Right.
I mean, if you have no hormones, the vaginal cul-de-sac and everything, it's like there's no circulation almost. You have to get all that optimized and to be able to produce your own vaginal secretions and keep everything healthy. Right. But it is amazing. If I do a pap smear on a woman that has no hormones, it's just pale and boggy.
You said
and then when they have their hormones optimized, it's just pink and red and vibrant. Wow. That is circulation. And you think that's what's going on with our body when we lose our hormones. Wow. So it even affects the heart, the bones, everything. It's so important. And I have seen some initiatives where I think within the next year, like a lot of insurances will start picking it up and stuff because because they have lifted a lot of the black box warnings off of hormones, period. So even your synthetic, they've lifted the warnings because they realized the only thing they did by putting all these warnings on these boxes is that we've caused women to have terrible bones, men and women. They have terrible bone densities. They're at higher risk for fractures and stuff like that. So they did, as of this year, they lifted all the warnings.
Oh, wow.
So, which is a good thing,
Yeah. Sounds like it. So it'd be great if insurance covered more of it.
Exactly.
For sure. But, okay, so you said that to me one time that in all the years you've done this, you've seen very few people, or no people actually, that had developed breast cancer.
Right.
That spoke volume to me.
Yeah.
I mean, it totally spoke volume to me, because I think that's one of the greatest things women, especially that hit menopause, are really, it's in the back of your head.
There's actually a higher risk of you developing breast cancer not optimizing your hormones bioidentically versus if you did it. So you have a higher risk of just not treating your hormones at all of developing breast cancer. Now, we all have an inherent risk. Just 1 out of 9 of us could inherently develop it anyways. But by doing bioidentical replacement, you will not increase your risk of breast cancers.
That's awesome.
It's actually just the opposite. It can be very protective. And that's what I've seen over the past 15 years. It's very protective.
So when you said that you went and Dr.
Donovan
pelleted you, and immediately, but even back on the plane, you felt like a different person. I remember you telling me you felt like somebody turned the lampshade or the light came on. Okay, so would you say that through all these years, you've pretty much maintained that vibrance and energy? I know
Yes.
you look like you're 20.
Yes, oh Lord, no, but yes, and I do have an autoimmune issue. So I did. Well, just to tell you part of that story too. The same time my hormones blew out, I developed the Hashimoto's hyperthyroid, not the slow one. It was the hyper. So I had the increased heart rate and all this stuff. And what was so amazing is that I was on my way to have radioactive iodine treatment on my thyroid to basically blow it out. And I had been pelleted for 3 months, and I was doing so much better. And my nurse said, well, why don't you just get your levels checked, and I'll call you on the way there because you're feeling so much better. And I thought, well, okay, I'll do it. He called me 20 minutes outside of Nashville, and he said, look, he said, your levels are normal. He said, they have all gone back to normal. So, to make a long story short, I didn't have to do that. And I do have a RA issue. And but I firmly, and my mom does too, and my mom pellets, she's 76, but Mom will tell you she would not be walking if she didn't. And so I firmly believe that if it wasn't for keeping the hormones balanced, that I would not be in really good shape right now.
You would not be an operating, functioning medical
I would
doctor.
not be a functioning good person right now. And because, the mental aspect of that too can be, very hard for people. You can have depression, anxiety, and things like that.
I have a story. After Joshua was born, I developed that. It is the most terrifying thing in the world. And I did do the radioactive iodine just for the test.
Yeah.
Just to test my thyroid.
Yeah.
I remember sitting there, Renee, in the bedroom, and I'd just be praying and just shaking like, God, help me, help me, help me, help me, because everything was moving so fast. And I remember going to the grocery store, just certain things, and thinking, are all these people in here normal, and I'm just like losing my mind, or what? Will I ever be able to go back to the grocery store normal again?
Yeah, and that's definitely a scary thing. But we know that directly the hormones dropping, and I've seen this clinically really in the past 15 years, that when you have someone and they have no hormones, you will often see a thyroid issue too. It's just, I don't know if some providers just aren't checking all the levels or what it is, but it's just a big deal, and you'll see that. But the big thing is we've got to have testosterone to maintain our heart, to maintain the vascular system. There's such a misconception that that's just a man hormone, and it's not. It's just as important for women as it is for men, except for if we're looking at a lab value that maybe LabCorp or something like that gives you. Their cutoffs are not what we want as far as bioidentically. We want the levels at a certain point so that we get that heart vascular cancer protection and things like that.
Makes sense.
And I really do think the more people are educated on how important it is, we'll have more people doing this, and we'll increase the longevity and increase, make it to where we don't have the likelihood of developing a lot of plaque in the arteries and things like that. So
we're getting our fountain of youth back.
Yeah.
That's what I look at
If you don't have your hormones balanced, you might as well spin your wheels on losing weight. It's not going to happen.
That was going to be my next
unless
question.
you're starving yourself. And then if that happens, you're going to lose your hair and everything else. There's a fine balance. I do have a lot of women that'll come in, and maybe some of their menopausal symptoms just has to do with hair loss. You see that?
Oh, yes.
Unless your hormones are optimized and the thyroid is optimized where it needs to be, you will lose hair during that menopausal state, and that is scary for a lot of women. And it did happen to me. Of course, I knew I had access to what I needed to do, but that can be a symptom that, some people will come in, they'll say, look, I'm just losing, my hair's coming out left and right, and it's a hormone issue.
And don't you think weight gain? So
yes.
A lot of the ladies ask me, explain this, how it does. It makes sense. If anything that's in balance and homeostasis, it's going to work.
Right.
So if you balance your body, your metabolism, I would think would become like somewhat normal like it needs to.
It does. It does, because number one, when you have your testosterone and your estradiol in balance, you're going to have more energy, you're going to feel better, so your activity increases. You're not coming home after work and wanting to sit on the couch because you have no energy to cook supper, you have no energy to go do stuff with the kids. On the weekend, you're spending all your time getting your energy back because you worked the whole week and you just feel awful. I mean, that's what happened to me. My joints were killing me. I just felt terrible. And that wasn't including the night sweats and everything else you have that goes along with it. And everybody is different. You know, not everybody is that dramatic. I think I was just on the way bad spectrum. Right. But I can tell you, it was probably life-saving for me, just because during that time, you can literally feel like you're losing your mind if you don't have help. You know, and this is, Dr. Donovitz wrote a couple books, and I buy these by the cases. Anybody who needs a book, wants to, he wrote these to where anybody can understand. You don't have to be a healthcare. This was the first book he wrote, and it was wonderful. This was for men and women, and if you have, it was 160 pages, and I have ADD terrible, and it's hard for me to sit down and sit there and read a 160-page book, but it was so good. I've read it 3 times. It's just so good. But I've had so many people tell me it's such a great book. And then his second one he wrote was How Testosterone Matters for Women. So it's really good, and it kind of ties everything, but I buy these by the cases to give to people because it's one of the best educational things anybody can read.
I need to read those for sure.
So
you gave me a couple, and I gave them to one of the girls in Dallas.
Take them with you.
Okay, so next, I would really love for you to tell the ladies, and guys, we will put in the comments how you can get in touch with Dr. Renee here in Union City. She does a lot of other things you guys are going to get to see in a minute live. I'm being very vulnerable today.
You are. You're doing great.
But for the good of the women,
yes.
You know. She's going to insert the pellets, and we're going to film it, so you guys will get to see a little bit of that. And then I'm getting some, what am I getting done today?
Botox?
Yeah, I think so. Maybe a lip flip or something.
Yes.
I don't know. Whatever.
I've been doing aesthetics also along with primary care, but my aesthetics I've been doing this is my 27th year. Literally. So I probably started around here before anybody started. Yeah. So I kind of, and at the time, it was because I was opening my own clinic, and, you know, the extra money and all that was good, but it just became my love.
I can tell this place is gorgeous.
And then the hormones and getting people, I love getting a hold of those people that are 42 years old and they just feel terrible, and I can figure out, okay, what's going on. I know there's going to be a hormone issue, but you can get things kind of straightened out. Right. And that's just my love to, you know, help people with that, because I know what it's like. Yeah. You know, definitely.
What is it they say? I say this almost every podcast. Your greatest place of pain is where you'll find your greatest purpose.
Yes.
And it's true.
It is true.
It is a gift.
That's
Even
true.
though we go through that hell, it's a gift.
And I've threatened my son, who wants to be a doctor. I've told him, I said, I don't care if I'm in the nursing home or what. If I need my pellet, you better be learning how to do it. But I'll be the one in the nursing home having her son come by and pellet her.
Can you get my son to come pellet me, please?
We'll have Kobe come do it.
Then you'll be pushing all the women around in there going,
that's right.
Y'all better get up. We're going to do exercise today. We're doing yoga.
Yeah.
We're doing chair yoga.
That's right. I just hope I live long enough.
You will, girl. You're amazing. Okay. Well, I'm so thankful that I met you. Okay, so how can, Renee and I even talked about maybe her at some point in the near future setting up where she does telehealth. She also has, and correct me if I'm saying the wrong thing here, baby. She also is willing to maybe once a month do a Zoom call with you guys for telehealth, and then do the blood work. And
if we have a place where you could get your blood done and I could send an order, that's really not hard to do. Sometimes there's like a lab core in certain cities and stuff. You can literally go to it. I can send the order and you can get the blood done. A lot of your insurances, when we code it right, they're going to, you know, cover for blood work. If it's something where, you know, somebody maybe has a real high deductible and we don't want them to get a bad lab bill or something like that, there's things we can work out to where that's not going to happen to you. But then once we have that blood, it's easy to kind of do a telehealth to go over some of the things that we know are going to have to be fixed and, what's going on.
So if they're local with anywhere around
Yeah.
Kentucky, Mississippi,
Yes.
Alabama, Arkansas, of course Tennessee is where we're sitting, but any of those areas, I'm telling you, it's worth the drive.
Yeah, it really, and I've got people literally that come from Nashville and Memphis, and they have places that they could go to in Nashville, but they just, it's once every 3 to 4 months they'll come and it just depends on how long theirs lasts.
Right.
Now, people that are extremely active and go, which, I'm running up and down halls all day long. So I typically can't go over 3 months, but there are some people that every 4 months they get pellet, and they do great. It's 3 times a year.
Right.
Men are typically 2 to 3 times a year, so it just kind of depends on them. I do have lots of men that can go every 6 months.
Wow.
So that's great. I just think they just keep everything balanced good. We've got everything balanced, and typically they're about 6 months. So that's
so you can do the telehealth. Also, that you can network. You have
Yes.
a network framework that you could send them to people because you want to make
Yes.
sure, especially if you take it to me, this is me talking, I may be talking out of turn here, but if you take it to that level and you've really connected with that patient and that customer, that you really want to make sure they're put in the right provider's hands. So don't just
Absolutely.
walk out and go to Tom, Dick, and Harry down the street because
Right.
they're pelleting.
Right, because I'm very strict on pellets.
She is. She sent me away last time.
Yeah,
It made me
well,
wait 2 more
because
weeks.
I don't get pellets from any Tom, Dick, and Harry pelleting, compounding place. This is very important. We have to have good quality. I want the FDA to be able to go in and pull batches of pellets, and that's the milligrams that's in that. That's what I want.
That's good.
And that's what we're going to have. And so, it's just important. And there might be people that live, in Texas or a different state that, that's too hard for us to connect up or whatever. But at least if we got the blood work done, I can get them to a provider there that's got a good reputation. We've already set what we know they're going to need, and they can do it. So,
Hey, you know what? I just had a thought, Renee. You and I talked about before the podcast, before we went live, about you were not opposed to coming into a group of women
Yes.
and doing. And
Yes.
actually, Rebecca and I that do this together are involved in a big conference in Nashville in October.
Oh.
I will send this to her and have her send it out because all these women
Yeah.
will be there from all over the country.
Yeah.
And then Rebecca and I are planning to do one somewhere around this area as we grow.
Yeah. Oh, yeah.
So,
yeah, and it could be where, if we had people, we can get together and
Right. I think
get
that
them
would be
taken care of. I just,
awesome.
the important thing is to get the message out and to help people get their hormones in balance, but to do it safely. Because there's a lot of unsafe things out there, but we want things that are made and produced in the United States. We don't want
Yes.
stuff being shipped over from
Right.
a different country, and you have to be very careful. You have to be careful. But the good thing about pelleting, it's all completely bioidentical. So it's plant-based. Your body knows exactly what to do with it. So it's different than shots, like shots and things like that, or a pill that you're getting from the pharmaceutical company. Those are more synthetic.
Right.
So there's a difference on how your body metabolizes it.
So I could tell that's what really sold me because I was taking those for years. I'm talking probably 15 years. I probably started the time
and
you
if
did.
you stop and think about it, if you remember, I can remember seeing your levels and I was like, you've got great levels, because she did her homework and she was using a compounding pharmacy that has a superb reputation. So if you remember, like I was
Yeah,
like, these
you
are
sure
great
did.
levels
You
for
sure
somebody.
did.
We just swapped and we just did the right milligram, and then in 5 weeks we checked her levels to make sure they were right on the money. And so you were actually using a really good compounding pharmacy.
but
so
still, even with that, the difference I could tell was phenomenal.
it is. There is a difference. I know.
I mean, seriously,
know.
it was like you said. You last said you had ADD. I think I have both: ADD, ADHD,
Yeah,
all the above.
yeah.
And it's like I can still function within that range. Like I can focus even in the middle of ADD, ADHD.
And you
It's
don't have
crazy.
as many issues with brain fog
Right.
and things like that, because that's a big complaint. The fatigue and the brain fog and just feeling like you're off.
Right.
You're just off.
Absolutely.
And it's usually always a hormone issue.
And even, I can talk about this because she and I did the first podcast together. To me, so that works for me. I kept telling her, begging her, you got to go see Renee.
Yeah.
You got to go see Renee. Okay. And now she's like, I will quit eating just to make sure I get pelleted.
We'll starve to death to go, so we don't have to go without our pellets.
Right.
No.
Right. The only thing we didn't touch on that I think we need to touch on just a little bit, even though Josh was sitting here, is about your sex drive, how it does affect your sex drive, and it really helps to increase that back to like you were normal.
Exactly.
That's how you got here too, by the way, boo.
Well, now that is a significant complaint that a lot of women will have as far as the vaginal dryness. Intercourse can be painful for some people because of the vaginal dryness. So when you do hormone replacement and we get the testosterone level where it needs to be, the good part about that is that will all be fixed. And it will be better than it was when you were in your 20s, I promise you, because you're producing all this on your own. So most women do not even have to do any type of lubrication at all, and they feel so much better. They have less incidence of bladder infections too, because we have more circulation. You're producing all your vaginal secretions like you should, and it will definitely increase libido and things like that. So, and you know, that's a big issue with marriages.
Yeah.
You know, that's a big issue. Like I said, just because we're getting older doesn't mean we have to be dead.
That's true.
Down there. So it should be better. So, you know, we try and get things leveled out to where we're really making that area so much better, and even for men too. So it's not uncommon for men at younger ages. I'm seeing it so young. I'm seeing men in their 20s now losing their testosterone.
Wow.
And that is so important, because sometimes men can have, maybe they can get an erection, but they just can't keep it. Or, you know, so all of those problems or issues can be fixed by typically getting the hormones adjusted out. And sometimes you have to do a little medication, but that's okay too.
Right.
But getting that leveled out is very important.
So she does work with men as
Yes.
well. My husband, Bill, does the bioidenticals, and he comes to Renee too. So, and I was kidding. You can tell me if this is a fact or not. It was so funny. We were at the beach, and we were leaving the beach, right? And this one guy follows us up, this young guy. And Bill, you know, is pretty buff.
Yeah,
and I think it's from the testosterone, a lot of it. But he
because
does
you
work
have
out.
more lean muscle
Yes.
mass, and that's what it's going to do for men and women. Give you more lean muscle mass, and you'll notice that over a period of time. So sometimes people will lose inches. They may not have lost weight, but they're noticing their pants are like, you know, they can go down a pant size and stuff. That's what happened to me, and because you're getting lean, and so
Right.
Bill's doing that.
Well, it's funny. So this guy goes, "Hey, brother, I've been watching you. How much do you press a day?" He goes, "No, not that much." And he goes, "Man, you're buff." He said, "I hope I look that good when I'm your age."
Yeah.
And Bill goes, "What did that mean?"
He just looks good for his age. Yeah.
Did you just call me old?
Yeah, I know. Well, and that is where he's been able to maintain that lean muscle mass. And so that's important too,
Right,
you know.
absolutely.
And that helps us because we don't have as much fatty deposit visceral fat. And so you will notice a lot of times on men, they'll go down some pant sizes and stuff,
Right.
you know, just by doing that alone. They may not see as much on the scale, but that's just because muscle's going to weigh more than fat. So
right.
you're losing more fat, which doesn't weigh as much, but it will help maintain that lean body mass.
So girls, the way I see it, and guys,
yes, it's
a
important for
win-win.
both.
There's no negotiating on this
Yeah.
level. To me, I'm serious. It is life-changing. It's game-changing. So we'll put her information in the bio, and also make sure if you get us the information, we'll get it to her to get the books.
Yes.
Okay.
Yes.
These
Very important.
are going to be life changing. I can't wait to read them. I know I passed it on. I didn't even read it, but I knew
I've given
used
people
it,
so many. I give patients, just anybody. I've had people just walk in and say, "Hey, so and so had a book, and I want to get one." I buy them literally by the cases. He literally charges $1.
Is he
That's
still?
it.
Is he still?
He's still,
practicing?
yes, he's still practicing. The funny thing is, he was an OBGYN for years and years and years, like very renowned. And
Wow.
then, but he did the hormone, he's kind of the godfather of pelleting, you know,
Okay.
which has been out over 100 years, but they do not teach this in med school. They do not teach it. They'll teach you how to deliver a baby. They'll teach you how to keep a baby alive, to deliver a baby, C-sections, all this stuff. But hormone manipulation is not in that wheelhouse.
Wow.
And providers do not learn how to do it. It's something that's a whole kind of subgroup in itself. So I think that's kind of where I had a bad problem getting somebody to help me, because we just didn't have anybody in this area.
Thank God that you are a digger of truth, I guess is the best way to put it, that you went after to find, because look, just one person, you making a difference in how many hundreds of women's lives.
Just I hope, and I hope it just gets better and
No,
better,
it
because
is. You
I
know
really
that.
think this is what's going to help with chronic disease management and stuff. So,
Well, I know I'm excited. I love you, and I'm so thankful that I met you, that
Well,
God
me
brought me
too.
across your path.
Me
and
too.
That you were on the I Got You Girl today.
Yes.
So you guys be sure, and if you have any questions or anything, definitely get in touch. We'll put all that information in there for you. And so thank you. I think I'm just to get pelleted.
And even if they need somebody that's close to them, I can get them hooked up, you know.
Okay.
That is no problem.
Perfect.
You know.
And we'll have her back on too,
Yeah.
for sure.
Yeah.
For sure.
Okay.
So thank you. I know she's busy.
Hey, that's
and
good.
this was great. I love you guys, and I will see you next week.
So all we do is just kind of clean the area real good. You will not have scarring on your bottom. I've been doing it for 15 years. I promise you, you cannot tell. Of course, now, personally, I wouldn't care because I need my hormones. But I'm just saying, you don't have that. The only thing you feel is just a little numbing shot. That's it. You don't feel anything else. We are not messing with muscles and nerves. We're only in the subcutaneous fat. So all we do is just a little numbing shot.
It doesn't hurt a bit. Matter of fact, I don't even feel that. That's a good thing.
Yeah, we don't want people feeling a bunch of stuff. We just don't
Right.
do that. And usually in that area, you'll stay kind of numb for a little while. So that's good, because you just go to bed, and by the next day, you're really not noticing anything.
And you told me not to bathe.
Yes.
I could shower.
You can shower.
I don't have to be stinking.
I usually have them leave on the dressing for 3 days. It's waterproof. You can shower. You just don't sit down in a tub or a hot tub. But then after that, you're good to go. So even people in the summertime,
I feel
usually they can
nothing.
do it during the week. By the weekend, they're ready to go to the lake or whatever they got to do. And what we do is we put the pellets through what we call a trocar. And it just literally goes right into the subcutaneous tissue, because that's where we have our baby capillaries. And the blood, we've actually done blood work to check this. If you do the blood work the next day, the blood is already going up in the levels. So your blood's already picking it up.
So between when we filmed and when we stopped to do this, Renee went over my blood work, which was excellent.
Really
Amazed.
good.
Even my cholesterol was down, and my
Your sugar, everything.
everything. It was like amazing, and I never had that doing the other direction. Just the
Thyroid was excellent.
So maybe that's helped with the weight thing.
Oh yes,
for sure.
that's going to help, because
sure.
that's going to help with the metabolism issues that we start noticing during menopause.
Lord, no, we have plenty of those. Eat nothing and it just sits there on your hips.
And what I do is we do steri strip. We do not have to do a stitch. A steri strip, and that closes everything. Usually by 24 hours, everything is just completely closed up.
I remember the first time I had it, it felt like, it doesn't even faze me now. I think it was the anticipation of, oh my gosh, there's something cutting my, hiney. And it was funny because it felt like it had to be this big. And I go to look at it when I take the bandage off, and it looks like nothing.
Little tiny. Like the incision is so tiny. It's barely like it's barely even 3 millimeters. So that's why you don't have scarring and stuff like that. It's just real tiny.
I think it's just the power of the mind,
It is.
Which is crazy.
Just the thought.
Right. So Joshua, you better get ready. Mama's going to be turning cartwheels tomorrow, baby, and it's just Thursday. We got one more day to go this week. We have been out this week 2 people.
Oh, wow.
So it's been very crazy. But you guys, I'm really thankful that Dr. Renee let us interview her today, and definitely reach out for sure. You won't be sorry. And I cannot wait from 6 months from now or even a year from now to hear all the stories.
Oh my gosh, that'd be so wonderful.
Wouldn't that be cool?
Too.
Life change, women. God, we all have that much energy. Our husbands.
The power of testimony is really good.
I was going to pull my pants up and sit up.
And we keep everything under the dressing kind of stays sterile. So, so we've never had somebody have issues with infection or anything like that.
Right.
But you do have to, I just tell people, leave the dressing on, forget about it. You won't even know it's even there.
And you don't.
And just, take your shower, whatever you got to do. And
absolutely.
We're almost done, just pulling off the...
It's funny when they run down. Tell me when you want me to sit up. Anyway, it's really funny. I'm so sensitive to energy and stuff, and Dr. Renee knows this, that the minute mine start to go down, I can feel it. Can normal people feel it? I guess I consider myself abnormal.
I'm one of those, I think, that's so sensitive.
Yeah.
That I can definitely, I will know the day or two my levels go down.
Really?
Oh, yeah.
That's me too.
And most people will tell me they can tell the week it goes down. So I just tell people, some people know exactly the time frame and they just schedule their next time. But
oh yeah, I do. But honey, listen, on my paper today is written down when I'm coming back. You can believe it. I will not miss, that's for sure. Okay, guys. So thank you. We love you. Definitely look in the bio, and you'll get all of Dr. Renee's information. And like she said, she'll get you books. She'll telemed you. Anything she can do to help. And I'm telling you, she's a jewel. You'll love her. And not to mention, you'll feel like a new person, which is worth everything.
It is. It is.
Everything.
Feel like you get your sanity back.
Without life, we have nothing.
That's right.
Okay, so see you guys later.
Bye. Thank you.